Hey, my name is Frankie Mays, and today we'll be talking about client care plans. So, the first client that I have, her name is Nancy, and her problem is that she suffers with fine lines and wrinkles. And so, I came up with a care plan, and for 6 weeks, the first week, I would do a facial with that includes microdermabrasion with red LED light, and then the second week includes microchanneling with glycolic and squalene. Microchanneling with glycolic in one of the passes that has glycolic acid, and then it also has squalene in it to moisturize the skin. The third week, we will go in with a facial that includes radio frequency to help with the wrinkles on her neck and lower jaw area. And then also go into that with a salicylic peel. Okay, the fourth week we'll go with facials with microdermabrasion, and then we'll do the LED light. I want to do one like non-abrasive, and then the next one a little abrasive, just so it won't be so much every time. So the fifth week is a facial with stem cells, and we're going to do a hydrodermabrasion, which is a dermabrasion, but it has water included in it, so it's shooting water into the skin, but also exfoliating the skin as well. And then we'll put some stem cells on there for cell renewal. The sixth facial we'll do for the 6th week is another radio frequency skin tightening, and then a glycolic peel. For home care recommendations, I wrote down that she should do a cleanser in the afternoons with salicylic acid in it, a salicylic cleanser, a scrub that has BHA in it, which is salicylic, and then for her serum, squalene oil because it's very hydrating and moisturizing. And then for her hydration, I think she should do hyaluronic acid to plump the skin. And hyaluronic, it has 1,000 times its weight in water, so it'll plump it and keep it moisturized. For morning, I put that she should do a salicylic cleanser in the morning. Serum would be squalene for moisture again. Hydration would be a hyaluronic acid moisturizer. Well, moisturizer that has hyaluronic acid in it, and then for SPF, SPF with zinc in it, zinc oxide. Okay, now we're going into our second client, which is her name is Michelle, and she has grade 3 acne. Okay, so grade 3 acne is she has open and closed comedones and inflammation. Okay, so for the first week, I recommended that we do facials that include microdermabrasions, extractions, and blue LED light therapy. The second week, we would do a facial with extractions and then a medium depth peel up with salicylic acid in it to just get all that gook out, clean the pores, and the salicylic get all that the bacteria and all the nasty stuff, the dirt and debris. Okay, week 3 will be another facial with microdermabrasion for exfoliation, a deep exfoliation, extractions, and a blue LED light for bacteria and stuff. The fourth week, facials that include the hydrodermabrasion and blue LED light, so we can really get into that skin and penetrate good ingredients into your skin. Excuse me. The 5th week will be facials that include extractions again, medium depth peel with glycolic acid this time. And then the 6th week, we'll do a facial that includes the hydrodermabrasion machine again and the blue LED light as a finisher to make sure that her skin has all the good serums and the good nutrients that it needs to continue to thrive and stay moisturized. For home care recommendations for evening, I recommend her to get, a glycolic cleanser to keep the bacteria and get all that gook out of her skin, keep it clean. Scrub with BHA and AHA in it. Serum hyaluronic acid to moisturize the skin. And then also for hydration, a squalene moisturizer. So that way her skin won't be dry. It'll be well moisturized at night. And then morning, I recommended a salicylic cleanser for her serum, squalene, hydrator, hyaluronic acid moisturizer, and the SPF will be a zinc sunscreen. Okay. Okay, the next client will be Ashley, and Ashley suffers from hyperpigmentation. So for week 1, I recommend that we do a facial with microdermabrasion to exfoliate the skin really good, and then use the red LED light. The second week will include a medium depth peel with lactic acid, so that we can lighten some of those hyperpigmentation spots, and also do microdermabrasion on that as well. And then the third week, we will do a facial with microchanneling, which is little needles going into your skin, and we're gonna do that and put kojic acid, which is another skin brightener that we can target those areas and really penetrate the skin. Okay, and then the fourth week, we're going to do facials that include medium depth glycolic acid peel to really get into that skin. The fifth week, will be facials that include microdermabrasion to continue to exfoliate, get that dead skin up, cell renewal, with red LED light. And then the sixth facial will be a facial that includes microchanneling, and we're going to do another kojic acid just to continue to any of the leftover hyperpigmentation that hasn't lightened up and gone away. We're going to just target those, do spot treatments with that. And then for home care recommendations, I put for her evenings to continue with a salicylic cleanser. A scrub would be a BHA scrub. A serum would be vitamin C to brighten the skin. And a hydrator would be squalene moisturizer. And then for the morning, her cleanser will be salicylic cleanser. Her serum, vitamin C again, continue to brighten the skin. Hydrator, hyaluronic acid to moisturize the skin. And for SPF will be a zinc sunscreen.